Hey guys, welcome to Medifaction. Today we are going to learn about the anatomy of esophagus. So we all know that esophagus is nothing but a part of alimentary canal which connects the throat to the stomach. So now let's know more about it. So in this video I am going to enumerate an introduction about esophagus followed by the curvatures, the constrictions, relation of thoracic part of esophagus, and abdominal part of esophagus, also the blood supply which includes arterial supply and venous drainage and some lymphatic drainage, and we are also going to discuss about the nerve supply as well as some important clinical anatomy. So let's begin. As an introduction, we can say that the esophagus is a narrow muscular tube forming the food passage between the pharynx and stomach. It extends from the lower part of the neck to the upper part of the abdomen. The esophagus is about 25 cm in length. The tube is flattened anterior-posteriorly and the lumen is kept collapsed. It dilates only during the passage of food bolus. So here you can appreciate how an esophagus is present in our body. Now let's move on to the next slide. The pharyngeal-esophageal junction is the narrowest part of the alimentary canal except for the vermiform appendix. The esophagus begins in the neck at the lower border of the cricoid cartilage where it is continuous with the lower end of the pharynx. It descends in front of the vertebral column through the superior and posterior parts of the mediastinum and pierces the diaphragm at the level of 10th thoracic vertebra. It ends by opening into the stomach, as you can see here, at its cardiac end at the level of 11th thoracic vertebra. Moving on to the curvatures. In general, the esophagus is vertical but shows slight curvatures in the following directions. There are two side-to-side curvatures, both towards the left. One is at the root of the neck and other near the lower end. It also has anterior-posterior curvatures that correspond to the curvatures of the cervicothoracic spine. Here it is well identified the upper lateral curvature and the lower lateral curvature. And in this figure, you can find out how the upper anterior posterior curvature looks like, and this is how the lower anterior posterior curvature looks like. Moving on. Constrictions. Normally, the esophagus shows 4 constrictions at the following levels. Number 1 is at its beginning, that is 15 cm from the incisor teeth. This here on the front is known as the incisor teeth, and now where it is crossed by the cricopharyngeus muscle. This is the cricopharyngeus muscle. Here is the first constriction can be appreciated. Where number 2, the second constriction is at where it is crossed by the aortic arch of the heart, which is at 22.5 cm from the incisor teeth. The third constriction is seen and is crossed by the left bronchus, that is approximately 27.5 cm from the incisor teeth. The fourth and the last constriction is at the level of diaphragm, that is right here. This will be approximately 37.5 cm from the incisor teeth. The distance from the incisor teeth are important in passing instruments like an endoscope into the esophagus. Relations of thoracic part of esophagus. When we are checking anteriorly, we can appreciate the trachea, and we can also see the right pulmonary artery right here. And we can also see the left bronchus on the left side. Pericardium with left atrium can be appreciated, and finally the diaphragm can also be seen anteriorly. Moving on to posteriorly, We can surely see the vertebral column, which is obvious. Right posterior intercostal arteries can also be appreciated. And we can also see here the thoracic duct. Number 4 is the Acygus vein, which is see here with the terminal part of the hemiacegus vein. We can also see the thoracic aorta and right pleural recess and also diaphragm in the posterior aspect. To the right, we can see here the right lung along with its pleura. And also we can see the Acygus vein and right vagus. Here is the right vagus. To the left side moving on, we can see the aortic arch. The left subclavian artery can be appreciated right here, and also the thoracic duct can be seen right here. The left lung and the pleura along with is well defined. The left recurrent laryngeal nerve, all in the superior mediastinum, can also be appreciated. And in the posterior mediastinum, it is related to the descending thoracic aorta, that is right here. The left lung and mediastinal pleura can also be observed. Abdominal part of esophagus. The abdominal part of esophagus is only about 1.25 cm long. It enters the abdomen through the esophageal opening of the diaphragm, situated at the level of vertebra T10, slightly to the left of the median plane. It continues with the cardiac end of stomach. The esophageal opening also transmits the anterior and posterior gastric nerves, the esophageal branches of the left gastric artery, and the accompanying veins. These veins of esophagus drains partly into the portal and partly into systemic circulation. Veins of accompanying left gastric vein drains into portal vein. Others drain into hemiacegus in thoracic cavity and continue into Acygus vein and superior vena cava. So it is a site of posterosystemic anastomosis. The esophagus runs downwards and to the left in front of the left crus of the diaphragm and of the inferior surface of the left lobe of the liver, and ends by opening into the cardiac end of the stomach at the level of vertebra T11, about 2.5 cm to the left of the median plane. Its right border is continuous with the lesser curvature of the stomach, but the left border is separated from the fundus of the stomach by the cardiac notch. Peritoneum covers the esophagus only anteriorly and on the left side. Anterior gastric nerve contains mainly the left vagal fibers and the posterior gastric nerve mainly the right vagal fibers. Each gastric nerve is represented by one or two trunks and combines a few sympathetic fibers from the greater splanchnic nerve. Arterial supply. The cervical part, including the segment up to the arch of aorta, is supplied by the inferior thyroid arteries. So, this is the inferior thyroid artery. The thoracic part, that is this part, is supplied by the esophageal branches of the aorta. This is the esophageal branches of the aorta. The abdominal part, that is below to that, is supplied by the esophageal branches of left gastric artery. This is the esophageal branches of left gastric artery. Coming to venous drainage. Blood from the upper part of the esophagus drains into the brachiocephalic veins. From the middle part, it goes to the Acygus vein, and from the lower end, it goes to the left gastric vein and vena acygus via hemiacegus vein. The lower end of the esophagus is one of the sites of portosystemic anastomosis. This here is the Acygus vein, which branches to the hemiacegus vein. Lymphatic drainage. The cervical part drains into the deep cervical nodes. This is the deep cervical nodes right here. The thoracic part drains into the posterior mediastinal nodes, and the abdominal part, which is right here, drains into the left gastric nodes. Nerve supply. Parasympathetic nerves. The upper half of the esophagus is supplied by the recurrent laryngeal nerves, and the lower half of the esophageal plexus formed mainly by the two vagi. Parasympathetic nerves are sensory, motor, and secretomotor to the esophagus. Sympathetic nerves. For upper half of esophagus, the fibers come from the middle cervical ganglion and run with inferior thyroid arteries. For lower half, the fibers come directly from upper thoracic ganglia to form esophageal plexus before supplying the esophagus. Sympathetic nerves are vasomotor. This is the sympathetic trunk. This is the pulmonary plexus. This is here is the splenic nerve. The esophageal plexus is formed mainly by the parasympathetic through vagi, but sympathetic fibers are also present. Towards the lower end of the esophagus, the vagal fibers right here form the anterior and posterior gastric nerves, which enter the abdomen through esophageal opening of the diaphragm. Now, let's discuss some important clinical anatomy. In portal hypertension, the communication between the portal and systemic veins draining the lower end of the esophagus dilate. These dilations are called esophageal varices. Rupture of these varices can cause serious hematemesis or vomiting of blood. The esophageal varices can be visualized radiographically by barium swallow. They produce worm-like shadows. Left atrial enlargement, as in mitral stenosis, can also be visualized by barium swallow. The enlarged atrium causes a shallow depression on the front of the esophagus. Barium swallow also helps in the diagnosis of esophageal strictures, carcinoma, and achalasia cardia. The normal indentations on the esophagus should be kept in mind during esophagoscopy. This is how a typical radiology, that is a barium swallow, looks like. The lower end of the esophagus is normally kept closed. It is opened by the stimulus of a food bolus. In case of neuromuscular incoordination, the lower end of the esophagus fails to dilate with the arrival of food, which therefore accumulates in the esophagus. This condition of neuromuscular incoordination, characterized by inability of the esophagus to dilate, is known as achalasia cardia. It may be due to congenital absence of nerve cells in wall of esophagus. Improper separation of the trachea from the esophagus during development give rise to tracheoesophageal fistula. Compression of esophagus in cases of mediastinal syndrome causes dysphagia, otherwise known as difficulty in swallowing. Hope you have understood the video. Like, subscribe, and press the bell button for more videos. Thank you. Thanks for watching.